Testing? Sounds good. All right, well, thanks everybody for joining us here. Glad to see an enthusiastic crowd as we're talking about this very important issue. My name is Katie Baker. I am the State Director for Protect Our Care. We are a nonprofit advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through events like this one that educate and inform the public of important healthcare issues that are happening. I want to thank our partners, the Commonwealth Institute and SEIU, for co-hosting this event with us here today, as well as our legislative champions, Senators Deed and Hashmi. I'm going to keep this brief, but I'm not going to mince words. Medicaid is under attack. We have about 1.8 million Virginians who are currently on Medicaid, and that includes about 600,000 who were able to obtain, actually slightly more than that, who were able to obtain Medicaid through Medicaid expansion. We already know that Donald Trump and Republicans in Congress want to gut Medicaid in order to fund tax breaks for the wealthy. Just last week, the New York Times reported that the House Budget Committee is looking at a number of different proposals that will be able to fund those tax breaks for the wealthy. There's a number of different ways that they could come at Medicaid, but specifically they even mentioned rolling back Medicaid expansion so that they're giving states less money in order to be able to fund Medicaid. That would be absolutely devastating here in Virginia. And let me be clear, this is the federal government's problem to fix. I do want to thank Senator Deeds and Senator Hashmi for doing what they can here. They have introduced budget amendment language that would remove trigger language from Virginia law that would actually automatically disenroll the entire expansion population. So there's more than 600,000 people if reimbursement levels for that expansion population drop just even 1%. So that's a common sense fix, but again, this is the federal government's problem to fix. We need to hold those Republican members of Congress accountable to the promise that the federal government has made to Virginians who were relying on this quality and accessible health care. And with no further ado, I will introduce Senator Creigh Deeds. Senator.
I want to thank the Commonwealth Institute, Protect Our Care, and SEIU for having us here. People that know me know that I don't like to get up in front of microphones a whole lot. Don't like to do a lot of press events. I'd rather let the work speak for itself, you know. But I've been around here a while. I can tell you that one of the most meaningful votes I took was in 2018 when we expanded Medicaid. We provided health care during the medical emergency period. Over 700,000 people were on Medicaid expansion. It's less than that now, but you know, as Katie said, we've got almost 2 million people in Virginia that are covered by Medicaid. About a third of them are the Medicaid expansion population. During the recent presidential campaign, or since then, the Elon Musk folks have said they're going to take as much as $2 trillion in federal spending. The president has said that that's not going to be Medicare or Social Security. Well, the only other place it can be for a meaningful amount of money is Medicaid. Medicaid expansion, federal government pays 90% of that. If the federal share is trimmed from 90% to 50%, which is the federal share of the remainder of Medicaid, that's $2.5 billion. $2.5 billion. I don't know where that money will come from. So over 600,000 people are at risk of losing access to health care because of this irresponsible act. It is a federal responsibility. We've got to hold their feet to the fire and make sure that the federal government addresses this. But this is something that is gonna affect real Virginians, affect people we care about. And we can't we've got to take whatever steps we can to make it happen. Ghazala Hashmi and I have budget amendment language in that would basically change the, when we passed the Medicaid expansion in 2018, we had to compromise a lot of things, but we have language in there, like about 6 other states, that says we roll back if the federal reimbursement ever dips below 90%. And so we've got budget language in to fix that. But I'm here to tell you right now, $2.5 billion is what it would cost if they rolled that back to 50%. $2.5 billion. And where we're gonna get that, I don't know. So this is on the federal government to fix, and we've got to make sure that our federal representatives hear us. And until that happens, Senator Hashmi and I and a lot of our colleagues are gonna work to make sure that Virginians don't fall through the cracks during this period of irresponsibility. We can do better.
Thank you so much, Senator. Senator Hashmi, who is the chair of our Education and Health Committee, wanted to be here today. Her aide, June, is going to speak on her behalf.
Hello, everyone. Thank you for being here. My name is June Laffey, and I serve as Senator Hashmi's Chief of Staff. As Katie just mentioned, the Senator did want to be here this morning, but she is currently chairing the Education and Health Committee, and she has asked that I say a few words on her behalf. Medicaid is one of the most powerful tools that we have to fight health disparities, poverty, and pandemics. Without Medicaid expansion, Virginia would not be leading the South in the percentage of people who have health insurance. Senator Hashmi introduced this budget amendment because she knows Virginia can and must be a leader in the wake of new federal incompetence. While federal Republicans and Donald Trump are trying to cut Medicaid in order to pay for tax giveaways for the ultra wealthy, Senator Hashmi and Senator Deeds and Senate Democrats are working to ensure that people have access to the health care that they need. That starts with removing the trigger language that would require the Commonwealth to automatically end coverage for over 600,000 people if the federal expansion reimbursement level drops even 1%. She is proud to work alongside Senator Deeds in order to prevent that catastrophe. But let us be crystal clear. We are here today because Donald Trump and congressional Republicans prioritize themselves and their ultra-wealthy friends over hard-working people. They do not care if the Medicaid portal doesn't work because they do not care about Medicaid. Here in Virginia, Democrats are working to protect healthcare and responsibly lower the cost of living for hardworking families and hardworking people. Senator Hashmi calls on congressional Republicans not to rip healthcare away from the people they represent. Thank you.
Thank you so much, June. Next, I'm honored to introduce Ashley Kenneth. She is the president and CEO of the Commonwealth Institute, who has done tremendous advocacy work in the area of Medicaid and are also policy experts. Ashley.
Good morning, and thank you. My name is Ashley Kenneth, and I am the president and CEO at the Commonwealth Institute for Fiscal Analysis. We are here today because the threat to the health and well-being of people across the Commonwealth is real. Lawmakers' decision in 2018 to expand Medicaid has profoundly impacted people across the Commonwealth. Today, over 630,000 adults have access to comprehensive health care thanks to this choice. And it has removed barriers to care, particularly for many people who are Black and Latino. Medicaid expansion has helped people in every corner of the Commonwealth, playing an especially critical role in rural Virginia, where over 1 in 10 adults have access to health care thanks to expansion. And it's been a lifeline for rural hospitals. Roughly 1 in 5 adults enrolled through expansion are parents. And we know that when parents have health coverage, their children are also more likely to have health coverage, making lawmakers' 2018 choice a critical investment in our children's future. Expanding healthcare access through Medicaid expansion is about more than health coverage. It's also about economic security. For people who are eligible due to expansion, Medicaid enrollment is associated with decreased concern about housing, food, healthcare costs, and more. Today, far fewer families have to make impossible decisions between seeking the healthcare they need and putting food on the table. But our progress is being threatened at the federal level. Some congressional lawmakers are pushing a tax package that would primarily benefit the rich, and they are doing so at the expense of people with lower incomes. In order to pay for these tax giveaways to the wealthy, they are eyeing deep cuts to programs that provide critical support to many people in Virginia. One such program is federal funding for Medicaid, including Medicaid expansion, which could have devastating consequences for Virginia. Because of language in our state budget, with any reduction in federal funding, Virginia will automatically disenroll everyone who has healthcare access through Medicaid expansion. I was honored to work alongside advocates to win Medicaid expansion in 2018, and I'm proud to stand alongside advocates and legislative champions today to protect our progress. Ultimately, the federal government must continue to fund Medicaid expansion at its current rate. In the unfortunate event they do not, state lawmakers have the power to act now to protect the healthcare access of over 630,000 people. I am thankful to Senator Deeds and Senator Hashmi for leading the way at the state level to remove language from the budget that would automatically disenroll so many of our neighbors from health coverage. Budget leaders must follow their lead and include the senators' amendments in the upcoming budget proposals. Together, we can protect our progress and continue to prioritize the health and well-being of so many people who call Virginia home. Thank you.
Thank you so much, Ashley, for your leadership. Next, I'm honored to introduce Julia Newton, who is a home care worker from SEIU. Julia.
Good morning. Hello, everyone. Thank you for being here today. My name is Julia Newton, and I am a home care worker and a proud member of SEIU Virginia 512. I was in the General Assembly in 2018 when our union helped make history by successfully advocating for Virginia lawmakers to finally expand Medicaid to hundreds of thousands of Virginians in our Commonwealth. Our union members know how important Medicaid can be in the lives of the people we care for. Medicaid makes it possible for people with disabilities and elderly Virginians to receive the care they need and deserve. Home care workers make that care possible. We are essential workers that are paid through Medicaid in order to provide assistance for your loved ones. We make it possible for people to receive care and stay in their home. My story is just like so many others. Before lawmakers made historical improvements to Medicaid, including the expansion, I had to wait 10 years until my son was able to be approved for in-home long-term care services. That was 10 years too many. Thankfully, hundreds of our union members went to Richmond to share stories like my own and were able to get Medicaid expansion approved on a bipartisan basis. But now, congressional Republicans are trying to gut Medicaid funding in order to pay for tax breaks for corporations and the wealthy. Any reduction from the federal government for Medicaid expansion would mean Virginians automatically ends the Medicaid program. This would leave hundreds of thousands of people, many of whom seek home care services without care, and that is cruel and unjust. This is why our union is proud to join TCI, Protect Our Care, and Senator Deeds and Senator Hashmi in ensuring Virginia is able to adequately respond to this very threat. But make no mistake, this is also a Virginia congressional delegation to stand firm on. Republican lawmakers in Virginia should be speaking out against any efforts to cut crucial safety net programs in order to pay for Trump's tax giveaway for the rich. So thank you to Senator Deeds and Senator Hashmi for introducing this important budget proposal and we look forward to continue to work together to make home care accessible for all Virginians. Thank you.
Thank you so much, Ms. Julia. And now we will have Katina Moss, who is a Richmonder, who's going to share how Medicaid has impacted her life. Katina.
Hello, everyone, and thank you to Protect Our Care for the invitation to speak about the importance of Medicaid funding for me and my loved ones, and the harm that funding cuts could cause my family. My name is Katina Moss, and I am a proud resident of Richmond, Virginia. I am here today to ask Virginia's congressional delegation to say no to Medicaid cuts, and to ask state lawmakers to say yes to protecting the health care of hundreds of thousands of people across Virginia. My story is probably just like so many in Virginia. I am self-employed, and I lived without health insurance for years prior to 2021. But thanks to a decision from Virginia's General Assembly to expand Medicaid, cost was no longer a barrier to seeking the care that I needed. No person in Virginia should have to choose between affording care for themselves or providing for their family. And being able to access health coverage through Medicaid allows me to care for my parents without having to sacrifice my own health and well-being. But earlier this year, I saw reports that Congress was considering cuts to Medicaid in order to pay for Donald Trump's tax plan that would overwhelmingly help millionaires and billionaires. This would threaten the health coverage of people across Virginia, including myself. I try not to worry, but that threat alone is enough to cause great concern. Then I learned that because of state budget language, Virginia would automatically end coverage for everyone on Medicaid expansion if the federal government drops funding by even 1%. My health coverage, my safety net, and my ability to pursue my self-employed work while caring for my parents would be gone in a flash. With the current cost of health insurance and paying out of pocket for health services, I really don't see how I would be able to go to my doctor's appointments or, if necessary, get prescription medications if my coverage were taken away. There are over 630,000 people who are in my same situation. Keeping an eye on what is happening with federal Medicaid funding and wondering, will we have health coverage later this year, this month, or even tomorrow? That's why I am thankful to Senator Deeds and Senator Hashmi for introducing budget proposals that would protect my health care and the health care of so many families across the Commonwealth. Not only would these proposals remove the ability of the state to automatically disenroll me from coverage, but it would also set up a much-needed conversation about our next steps as a Commonwealth. I want Virginia lawmakers to be able to respond to federal actions and be able to discuss all of our options. We've come a long way since that 2018 decision to expand Medicaid. We have seen how critical having health coverage is for families' health and financial security, and how beneficial it is to Virginia as a whole. It's only right that today's lawmakers get a chance to weigh in if the federal government cuts funding to Medicaid. I want to emphasize that accessing health care through Medicaid allows me to work and take care of my loved ones. I ask Virginia's congressional delegation once again to please say no to Medicaid funding cuts. And state lawmakers, please say yes to supporting over 630,000 people across the Commonwealth and protect our care. My loved ones and I and families across Virginia are depending on you. Thank you.
Thank you so much, Katina. I'll just close by saying that Medicaid is overwhelmingly popular. Robert F. Kennedy Jr., who is disgustingly unqualified to lead the Department of Health and Human Services, said in his confirmation hearings incorrectly that Medicaid was not popular. For those of you on my press list, I said a fact check yesterday that includes polling showing just how popular Medicaid is with Americans by and large. Actually want government to invest more in Medicaid and not cut it and not rip healthcare away from 72 million people across the country. So with that, I want to go ahead and thank our speakers and open it up to any questions from press. Dave Rest, I saw your hand first.
I had a question actually for Senator Deeds, and that's if the budget language goes through the moving trigger, and if Congress actually does do the rollback, what the heck happens in Virginia?
Well, what happens, no matter what, whether the language goes through or not, is that we're gonna have it go back into special session in that circumstance and figure it out. As I said, if they just roll it back to 50%, it's got a $2.5 billion price tag for Virginia.
Over 2 years or 1 year?
It just depends on what the federal election is. That's 1 year. That's 1 year. So it's a huge price tag. And if they eliminate it completely, you know, that's over, as so many speakers have said, that's more than 600,000 people who would potentially lose their health care, and we really can't afford that. Everybody recognizes that when the workforce is healthy, our economy's healthy. We've got to figure this out.
So if the trigger goes away, if they cut, does the state step in financially to keep the program going?
We'll have to figure that out. I mean, I don't know, the state doesn't have $2.5 billion to put into this. And as you see, you know, when we have a surplus, a so-called surplus, at one time, there are lots of people that have ideas for that, including the governor. And so even when that surplus is not continuing, it's not like we're gonna have $2.2 billion extra every year. So we're just gonna have a lot of figuring out to do. And it's really gonna be a struggle to do that. That's why we need to make sure that the federal government fixes this problem by backing off of these cuts.
People lose coverage or tax increase, or do we know yet?
You know, for now, we're gonna focus on keeping the pressure on our federal representatives to do the right thing. Because we will have an incredibly difficult Sophie's sort of choice if they actually make the cuts.
I wondered about the special session. You brought it up just now when I asked you about this last week. You predicted a special session on this. What would even happen? Are you gonna find $2.5 billion under the couch?
I don't know, Michael. I wish I was someone that could predict the future. But if we are faced with that circumstance, we'll just have to deal with it. All I know is that we can't afford to have over 600,000 people without health insurance. I think that would be catastrophic for the state's economy.
I think Elizabeth had one back there and then Megan.
Yeah, sorry, what's the likelihood of your budget amendment passing? Like, what have you heard from your colleagues?
Well, you know, we've had a lot of discussion about the budget amendment. Whether that specific language I think it's likely that there will be some language that addresses this in the budget. Will it be that precise language? I don't know. We aren't there yet. We'll be there by Sunday.
And then Megan.
Yeah, just following up, like, potential scenarios to cover, you know, this, like, can healthcare organizations help or
A lot of things could happen. Dealing in hypotheticals is very difficult. So a lot of things could happen. But it's just a circumstance we don't want to have to get to. You know, in 2018, we recognized that there was a potential for this, but we also recognized that since 1965, there were so many people that said, what if the federal government reneges on their promise? Since we've had Medicaid since 1965, the federal government's never reneged on a promise. Will they under this president? I don't, you know, maybe that's the precedent he wants to set.
Virginia has an innovative set of programs for waivers for non-medical services for people with disabilities. Are any of those at risk with what they're talking about in DC?
I think everything's at risk. I think everything is at risk. We will just have to as I said, it's difficult to deal with hypotheticals, but everything's at risk until it's not.
And I think, that's a good way, to close, and I would just add, I believe the governor has a direct line to the president, so it might be a good question for him to be asking the president. Just wanna thank, Senator Deed, Senator Hashmi, all of our speakers here at TCI, SEIU, for this important conversation. And if any of the speakers do have time to linger and chat with any, reporters, would certainly welcome that. I do wanna get a group picture before we break up, so if people wanna maybe line up, where do you want people? Over here.